For those I haven't met before, I'm Miranda. I'm one of the founders of Every Dog Behavior and Training. We are located in Austin, Texas. I would love it if you pop in the chat box with where you are from and whether you are working with cats professionally, whether you are a cat person, whether you're a dog person and you just want to know more about cats, whatever the thing is, so we get to know a little bit more about you. So for tonight's webinar, a couple of quick notes. One is there are closed captions through Zoom. So if you would like captions, please feel free to turn those on. If you have any questions or you can't find them, let me know. I will also ask that everyone keep themselves muted during the call today. That way we make sure that we can hear Tabitha throughout the presentation. If you have any questions at all for Tabitha, please put them in the chat box. If you're having some kind of technological difficulties, feel free to put that in there and I will troubleshoot where I can. If for whatever reason you get kicked offline or you have to leave early, don't panic. We are recording this and I should have it out to everybody tomorrow or Saturday at the latest. So it'll be posted for everybody. And then my plug that Every Dog Austin is a 501c3 nonprofit organization. We provide financial aid on a bunch of things, as well as these awesome free webinars. So thank you to everyone that donated to get their registration today. We really appreciate it. And if you are interested in donating, it is a great cause. You can check us out. We also have really cute t-shirts all about dog training, which I know we were talking about cats today, but it's still cool. Dog training is for everyone, even cats. So if you would like to support us, those are some great ways to do that. And without further ado, I will kick it over to Tabitha to introduce herself and get us started.
Awesome. So thank you for having me. Every Dog is such an amazing organization and they have so many amazing resources at their website. I love them. And I love Miranda. So my name is Tabitha Kucera. I own Chirrups and Chatter. It's a cat and dog. So I work with both species. You can love every species of animal. I even love humans. I love kids. I'm a unicorn. So I own a cat and dog behavior consulting business. I'm a registered vet tech that is boarded in behavior. So it's a VTS, a vet tech specialist. I'm a certified cat behavior consultant, a Pryor Academy certified training partner. Learning is cool. And I'm elite fear-free and low stress handling certified. And I actually work with fear-free in multiple aspects. So that's just a little bit about me, but I'm going to just get started. So I'm going to share my screen really quick here. Awesome. And can you just confirm that you only see one slide?
Yep.
Great. I have multiple monitors. Offices are cool. Okay.
Well, I can see, do you speak cat? Oh, yeah, there we go. Perfect.
Oh, great.
Yep.
Thank you. So these are the quick learning objectives. We're going to talk about why words matter, especially the more and more I learned about behavior, whether I'm talking about a human or an animal. I've really recognized the importance of the language and words that we use to describe things and how much they make a difference. Of course, we're going to talk about how cats communicate, body language, and then a few examples of putting it all together. So when it comes to describing animals, and this is, of course, if you're talking to your own cat, relationships, context matters, right? I can say my partner's being a butthead, but if some stranger says it, what? So especially if you work in animal welfare, because I work in animal welfare behavior, but also veterinary medicine, that's really important where we really want to consider what words we're using. Now, if you're talking to your friend, that's a little different, right? But ideally, we're going to always use objective language versus objective. So objective, not influenced by personal feelings, based on facts in 2024, everybody, love to see it, versus subjective, which is influenced by personal feelings, taste, or opinions. So it is raining, and I love the rain, harmless, right? But what I commonly hear, and this is from my lovely cat caregivers, but also from a lot of animal professionals, is my cat is mad at me, so she went outside the box, versus what's actually happening. My cat is having accidents and may need medical and or behavioral help. Or that cat is a mean, fill in the blank. The amount I hear the A word in animal welfare and vet med being used to describe cats, and I'm sure I've done it at some point when I was a baby tech, but it breaks my heart, versus what's actually happening, the cat is fearful. And the reason why you're like, oh, it's just language, it's not that deep. But you have to realize, even if you love your cat, as someone that sees mostly severe behavior issues, even if you love your cat and you feel your cat went outside the box to spite you, fun fact, cats and dogs don't feel spite. That's a lovely human thing. You are more likely to not be empathetic towards that situation. And you are less likely to reach out for help to someone like me or reaching out to your veterinarian. Because just like if my friend was being not the kindest to me, and I would have been like, what? But then I have context of she got fired the week before or something like that. So we need to consider that. Here are two other examples. This, to be fair, this cat is very relaxed, which we'll talk more about. But if people misinterpret this cat as waving hello, which I do clicker train cats to wave and high five, but in this context, no. Let's say a child sees this cat, the mother and the child misunderstand that this cat is waving hello. They misinterpret that as I want to hug cat. Cat gets hugged. Cat understandably gets conflicted, stressed. Maybe some of those more subtle signs don't get recognized. So the cat starts wiggling. Cat does not, maybe we don't recognize it. And then the cat escalates and bites child. I am having a very in-depth conversation and helping once that caregiver reaches out. But now I have a child that might have trauma around cats for the rest of his life. And I have to talk to a parent about a specific, like a pretty serious situation. This is more for my animal care people, because as caregivers, you most likely aren't hearing this word, but I'm a little sensitive to it as a vet tech. So this cat is fractious versus this cat is fearful is what actually is happening. And an example how this word can be really dangerous. In vet med and animal welfare, we commonly have indicators in their history form, so we know, but also sometimes on their cage, because multiple people are working with these animals. So that's helpful. Labels can be helpful to an extent. But if there is a sign that says fractious on it, even if I don't know what considered approach is and feline friendly handling, I am going to go in there tense, freaked out a bit, being like, I don't want to hold this cat, versus if the sign said the cat is fearful. Again, I can know nothing about fear-free handling, considered approach, and I'm going to accidentally, subconsciously move slower, be calmer, be more empathetic, have a plan. So again, the language we use really matters. So ideally, instead of labels, we should be describing what we're seeing. And there's a lot of reasons why, but these are just a few. Labels don't describe behavior or its cause. So you saying the cat is spiteful, that's not helpful information. I mean, it is from my perspective, because I'm going to ask, like if a caregiver says, or let's say a potential adopter says, my cat's being an a-hole or whatever, I can change that around and say, what behaviors are you observing that make you feel your cat is? So I'm already helping them kind of get out of that narrative and actually get helpful information. So as animal professionals, you can do that. It also puts the cause of behavior inside the animal. So my cat was mad at me. I had to go out of town. What I'm going to have to let him outside. Like kind of creating these narratives and stories why this behavior occurred versus actually looking at the functions and the functions of the behavior in the body language. Science is awesome. And it can't be tested. So as someone that works a lot with really fearful cats or in animal welfare, I'll hear things like, it's been 2 weeks. This fearful cat is socialized now. And I'm like, based on what? Because 2 weeks is nothing. That's not a helpful indicator. Or I feel like the cat is better. Based on what, right? So it's challenging for everybody, because people are like, even these amazing fosters are like, I feel like things should be better, but I don't know why they are not. And when it comes to, for example, the way I teach behavior modification for helping fearful cats, there is clear observations and criteria for both me to let the cat tell me and the foster or animal welfare or vet med professional that's working with that cat. It's not just, it's been 2 weeks, which is not helpful data. It's, oh, she just did a normal stretch and she returned to baseline quicker, all this lovely stuff. So that's helpful too. And then of course, the cause of behavior is found in context and not in animals. Like that cat example where the cat bit the child, that was a predictable behavior. That cat gave probably 15 to 20 signals that were accidentally, non-maliciously missed. And that's something that I can easily help with as a behavior professional by helping the caregivers identify body language in cats, respect it, let them know what appropriate touch and play are, all of that lovely stuff. So these are just a few of the fun labels that I see used every single day, even by all of my amazing cat loving people. I love my cat lovers, but all of the memes that I see them sharing all the time is just heartbreaking. Because poor cats are vilified in society. And as cat lovers, we should be doing what we can to prevent those. Like, they're aloof, they're mysterious. Nope, they're not, all that lovely stuff. So this is just a little ladder of aggression. We have these similar to dogs and humans. I just like to share this because sometimes I'll hear that happen out of nowhere, right? The cat just became angry. And although there are very rare instances where there may be some neurological issues and some other things, but again, that is not common. What more likely is happening, a lot of those more subtle signs, I use the word subtle, but they're not subtle. It's just once you identify them, right? They actually yell out at you. What happens though is usually those are missed. So understandably, that animal continues to escalate because displacement behaviors didn't work, which is subtle science of saying, give me space. And then the cat started wiggling out of the child's arms, did not let go of cat. And then the cat started vocalizing, did not let go. Of course, the cat had to bite. That was the only thing that would make the terrifying thing stop, right? So I think it's important to remember that fear, anxiety, and stress occur along a continuum from, and this is for a vet med example, right? From barely stressed at all to severely stressed. So this is just, I like to use body language scores. So we score their body language, which is really helpful. So level 1, we expect most animals to be stressed at the vet because they're going there because they don't feel well. So there's nausea and pain, but also there's a lot of other stressors in the environment, although there are things we can do to manage that. But let's say they're at level 1, and then level 2 or 3, these patients take longer to return to baseline if we do not recognize body language well. And that's what commonly happens. And then level 4 or 5, these are the cats that you may have worked with, or maybe your cat even has really severe fear and stress associated with veterinary handling. And in that case, they essentially feel like they have no choice. So in many cases, they may utilize aggressive behavior to make the scary or painful thing stop. So again, I think it's just important because I hear things like that happen out of nowhere. This cat's just angry. And in many cases, there's a lot of signals that they are indicating their discomfort, whether it's with a trigger, like a human, or with a type of touch. For example, a lot of people recognize when their cats bite them, like a quick, it's still not great, but more like a chomp when they're petting them. But usually prior to that, the cat has stopped and looked at your hand. The cat's maybe froze for like a second. The cat's tail may be twitching. There's a lot of signs that that cat is not enjoying that petting. And the only thing that makes the thing stop, the hand touching me, is a chomp or a scratch. And then they disengage. So it's so awesome that all of you are here so we can recognize those earlier signs and either stop the touch, change our approach from a handling perspective, or if there is a trigger, if you can, in most cases with cats, thankfully you can, increase the distance of the trigger to cause your cat some relief from that. So when it comes to looking at body language, it's really fun because we have to look at the whole picture. So I look at facial expressions, eyes, ears, tail, whiskers. I never used to look at whiskers until I got really into behavior. Speed, direction of movement, shifting of cat's weight. So I am looking at everything because that's how they're communicating how they feel. And thankfully, they give us a lot to be able to understand them. But I think it's also really important to remember context, right? And these are just a few things to consider when we're seeing that body language. So we want to consider physiological elements. That's a really huge one, especially with animal care. Is that animal painful? Do they have some chronic disease or illness? Do they have sensory deficits? The amount of animals I work with who exhibit aggressive behavior, whose vision is not 100%. So they startle easily, and that wasn't even on anyone's radar. But if you don't see as well as you're aging or have some other sudden change that causes some vision loss, of course you're going to startle and maybe even bite when a random person or there's some type of touch. But again, that's a fairly easy thing for us to identify and manage, which is great. We also need to consider physical traits and attributes. So, for example, if a cat had a tail that was injured due to some thing that happened to them and their tail was amputated, we can't look at the tail as an indicator of how they're feeling because that tail isn't there, but we still can look at everything else. We also have to think of where we are, right? Are we in a shelter? Did this cat literally just come in? Is our intake room filled with other cats and none of the cats have towels over their cages or classical music to drown out some of the stressful sounds? I understand why this cat may be more escalated in this situation versus in a home setting with a familiar person. Are you a familiar person? I'll be honest, as a behavior consultant, vet tech, and someone that works in animal welfare, I'm usually a stranger to most cats. And that's a lovely way to think of it. If it's your cat, that's great. But in most contexts, we are strangers. So we should we should respect our cats too, but we need to consider that. And then also prior learning. So cats are learning all the time, just like dogs and humans. So we want to, sometimes we're not going to know that cat's prior learning history. In many cases, we don't. Like they come to us. But for example, let's say I'm interacting with, I deal with human-directed aggression a lot. And in many cases where I get more context and information, some of the cat's learning history is people did the whole I pet your belly thing when you're a kitten, which is not appropriate. We played with hands a lot. That's that cat's learning history. So now they think hands are toys and they bite quicker. They don't have as much bite inhibition. So we need to consider in some contexts, if we know their current their past learning history, but even if we don't, we can still guess, like, right? I'm familiar that most cats have negative experiences with carriers, even though I'm working really hard to help people be less stressed and stressful when putting their cats in carriers. But I know that most cats exhibit more stress in carriers because usually most cats' experiences with carriers are negative. Thankfully, it's getting better and we're helping people realize that you can teach your cat to love your carrier. But so this is a beautiful cat's face. And this is everything I look at: eyes, pupils, whiskers, mouth, tongue, ears, the tension throughout the face. And what I mean by that, I think with dogs, it's a little easier to see, especially with larger dogs. But I see and feel tension, even subtle tension. And that is so helpful, especially as someone that works a lot with cats in a medical standing, like, aspect. So this is these are two really great photos of tense versus soft. So you see this orange kitten, your heart rate's lower just looking at this kitten. Eyes are almond shaped, ears are forward, whiskers are sitting where they naturally are. And we're getting a lay on the side with limbs away. So this is a very relaxed kitten. This other kitten, there is some tension throughout that face. This cat is actually focused on a toy that they're about to kill. So this isn't a stressed out cat, which is why context is important. But I could see how maybe someone would just see a photo in a second and maybe say, oh, this cat may feel conflicted, which is why context is so important. But it's a really good visual of tense versus soft. So we're going to get into each body part. So we're going to start with eyes. So we all have seen the beautiful, happy, content, relaxed cat. They have those almond-shaped eyes, those constricted pupils. They slow blink at you. And slow blinking is real. It is something that you can do to help communicate to cats. Now, if you have a cat that is FAS5, which is a very fearful cat, probably not the most appropriate thing to be like. And also, if we are slow blinking at a cat, I think it's important especially in animal welfare and vet med, or even if you're at home and you're really busy, we're running around, we're doing so many things, we're really tense because body language is physiological responses. We can't really control them, and neither can our cats. So we'll go up to the cat and slow blink, but we're really tense. So I think it's really important if you're going to slow blink, you want to take a deep breath, slow blink, and look away. Because sometimes they see, and I'm like, I love where you're coming from, but I don't think you realize how tense you are and you're not looking away. But slow blinking is an if the cat is slow blinking at you, that is an indicator that they're feeling fairly relaxed. And then, of course, as that cat gets more aroused, alert, excited, or fearful, those eyes go from almond shape to round, as you can see here. So that first cat, they're going almond to rounds. For brow is fairly soft. Second cat, brow is fairly soft, but those pupils are getting a little bigger. Those eyes are going round, but it's because, Mom, get your phone out of my face, Mom. It's weirding me out. So again, both of these cats on the top, a little less conflicted versus these cats on the bottom. It may be hard to see, but there's a lot of tension in their brow just based on this one part. And those eyes are becoming round and those pupils are getting essentially taking up their whole eye. So these cats are pretty, like this last poor little kitten is terrified. And this third cat is becoming conflicted and fearful. And this is just a fun note for all my animal professionals out there. If you are working with a cat and they may be in a cage, and again, they may be painful, which also affects behavior. I'm going to be more aggressive if I hurt. I'm going to be more stressed if I hurt. So let's say you're working with a cat and they're exhibiting some signs of fear and discomfort and plus or minus pain, and you're approaching and you notice that those dilated pupils become constricted, you need to stop what you're doing. I teach handling for a living. I'm very advanced in handling, and it is not appropriate to handle that cat. Because that cat has been pushed so far that they feel there is no choice but to lunge and attack. So more offensive aggression. Again, not very common, but just a fun note, because sometimes people are like, I got it. I'm like, it's not something to be proud of. There's things we could do to help make this less stressful and more safe for everyone. So just fun little note, more eyes, so much, right? So again, this adorable, floofy, handsome, fat boy, I love him. You can see that's the softest face ever. He's just like that freaking Flash, Mom. What are you doing? So super soft face. And then there's this cat, and sometimes cats can show body language that can be indicative that they're cold. So again, I like to use human analogies because we're humans and it's okay. We're all about ourselves. It makes sense. So this cat that's huddled is kind of similar to a human, like shivering, right? So they're kind of closed a little, and then we have the airplane ears. And then there's these guys, right? So this is something I see a lot in animal welfare. They're essentially so severely stressed that they are essentially faking sleep, similar to the person in a horror movie that's in the closet and they're like as small as they possibly can get and closing their eyes as tight as possible, right? So these cats are severely stressed, and I triage behavior like I triage medicine. And these are cats that are bleeding out. So we need to get some work. If we don't have a evidence-based animal welfare positive behavior team, we need to work with someone like me or somebody. Of course, we're going to provide these cats with hiding boxes. Every cat gets a hiding box every time. But I could also understand how someone might walk past these cats and misinterpret them as resting. So this is where body language is so helpful. They're communicating with us all the time. Ears are pretty similar to dogs, right? So we have up, alert, I'm neutral, I'm focused. I might hear something because cats are amazing and they are prey and predator animals. They do not have 32 muscles in your ear to ignore you. I seriously strongly dislike cat memes. So it's more so I can hear that mouse, or let's say I open this door and my cat was in here, his ear might go similar to if I heard a sound. I have to move my whole head though, because I'm not as cool as a cat. And then as they become more conflicted and or stressed, those ears go into earplay mode and down to the extent of, again, ideally, I'm not seeing this very often, most likely because I addressed body language prior to, but this cat right here, you can barely, the ears are essentially not there. They're so close to their head. This cat is terrified. Whiskers. So whiskers tell us a lot too. When a cat is in a good mood or neutral, relaxed, their whiskers naturally sit where they are and they kind of have a gentle curve. And then as cats get more excited, alert. So again, it could be like, I see a bird outside. It could be a bird toy. It could be you getting a treat, right? We notice that those whiskers start to fan out a bit. So this is my cat Jelly Bean. She was looking at some awesome birds. And as you can see, her eyes are almond shaped. Her pupils are constricted, most likely due to the sun in this context. Ears are forward. Those whiskers are subtly starting to splay out because she's just a little more alert because of the birds outside. And then there's this really beautiful photo. There's a toy in front of this cat. So whiskers will actually come out and extend past the muzzle so they can kind of feel what they're seeing. Cats are so cool. I know I work with them and know a lot about them, but I still am amazed by them all the time. This is as the cats become subtly conflicted, right? Those whiskers can go down. So this is my cat, Malt. I got engagement photos of my animals because do I need more photos of me and my partner? No. So my photographer had a humongous camera and she took a step forward to my cat and I noticed that her eyes went, because again, they're still fairly almond shaped, but they're getting a little round and her whiskers started to go down versus here just a little bit. And I said, can you just take one step back? And then my cat's whiskers instantly went back to baseline. And it was not, my cat wasn't going to attack her or anything, but I recognized that my cat was a little conflicted. And why would I not manage that if I can, right? And then this is a really great photo. I don't know if you can see, but the one side, the cat's whiskers are down and the ear is actually to the side and that paw is up versus the other side where those whiskers are where they naturally sit, that ear is forward. What happened was someone walked into the exam room. So the cat was like, and then I don't interact with a cat or an animal. I don't interact with an animal the second I see them in vet med. So I started taking history and the cat returned to baseline instantly. They were just like similar to how many of us would. That's like a quick startle response, but you could really see the difference in those whiskers. And then as they become more fearful, they similar to ears, right? They go closer to their face. And I'm going to talk more about pain whiskers because whiskers can also tell us so much about pain, but I'm going to talk more about that a little bit later. We're going to talk a little bit about arousal and fear. So this cat is, you've all seen this cat like, wow, my whiskers are splayed out. I might be pacing a little quickly back and forth. So these are cats that, especially in an animal welfare setting, let's say you're coming into the shelter and they're like, that just tells me I probably should increase their enrichment, right? But also, when I'm walking in, opening their cage or I'm walking into that room, I deal with a lot of bites where, because I do organizational consulting. And in many cases, people are misunderstanding this cat who's like, they run up to the person and they're rubbing up against them really fast. So again, I can understand how it gets misinterpreted as an invitation to pet. That is not consent from a cat. And that cat is moving very quickly, probably because they're bored and they're super stoked to see you. So because many people would reach and then pet and then cat would bite. And then I was contacted, which is great. And then we worked together and we would just have people come in with a wand toy, a long enough wand toy. And okay, or cat gets a puzzle toy when we get in there while we clean up, or I just use considerate approach and I don't pet you unless you give me consent. And you're really excited right now. And usually within a minute, the cat starts moving more slowly. The whiskers go more into place. The cat's not vocalizing. Then you pet them, right? Some other signs of overstimulation, right? Ears, back, sideways, or flat. There's a lot. tail flicking or lashing, so a flick versus a lash. You may notice there's skin twitching. We can also see that with some medical things as well. Their claws may be out. Again, this cat on the bottom, he's doing a one play session. So he's full on trying to attack that toy, which is great. This is my cat. And this is the type of hair standing up or piloerection I commonly see that I think subtly, usually people recognize Halloween cat, but at that point, that cat, woo, they've been pushed quite a lot. I very rarely see that response. So this is usually what we tend to see, this subtle hair standing up, and he's watching birds outside and his tail is twitching. And he's my cat, and for context, his baseline is a little overstimmed. He's like his mom. We don't like to sit still. We like to have more outlets than other people. So that's important to know too. But that subtle hair standing up, I wouldn't pet him while he's watching birds. Again, he's not going to bite me, but I want to be respectful of him either way. Our goal should not only not to be getting bit. Tails, I can go on and on, but we only have so much time. So cats use their tails for balance, to deposit scent, express connection and affection with others, and to gather sensory information. So some of the more common ones that we all see is the happy tail. So it's a princess wave or a question mark. That is usually indicating, because we're looking at the whole picture, but usually that goes along with very relaxed, soliciting attention. Like you have your hand out. I don't extend my hand out because that's very rude. So I have my hand and my fist out. They may approach me with a curved tail and lean into my hand. That's consent. Or they just have a straight tail. That's usually, I'm happy to see you. All of you with cats at home who, when you come home, they might scratch or start to really shake their tail. They're so stoked that they just can't handle it. It's beautiful. And I know a lot of people who actually punish. I don't recommend using aversives in humans or animals. There's enough of those in the environment. But I know people that their cats are just like, I love you so much. And people actually punish their cat for that because they think the cat may be marking, even though the cat has no history of marking. So tell your friends, don't punish your cat for that. Well, don't punish your cat at all. And then similar to dogs, right? As the tail goes down, that's more conflicted and closer to them. If the tail is neutral, like to the midline, so you might bring a box home or a bag home and your cat might be a little unsure and they are kind of checking out a new thing, or a cat in a vet exam room where they're exploring. So they're just like telling us like they're checking things out. So my tail is, I'm interested, what's going on? And then in many cases, a cat's tail will just floof up. So you guys may have noticed this with your cats at home. Maybe something falls. So it's a quick startle response. And the cat or the cat's tail floofs up and then they instantly return to baseline. But I froze too, because that metal bowl fell. So that's what we commonly see there. And when it comes to where the cat's weight is, that also tells me a lot. So I'm looking at where's their tail and position in relation to their body. Where's their head? Is it neutral, which tends to indicate neutral, relaxed? Is it high, which can indicate excited, alert, offensive aggression? Or is it down, which can indicate pain, conflict, stress, fear, right? But again, I'm looking at the whole picture, so this is giving me a lot of information. Where is their limb and paws placed? So this guy, his tail and his limbs are as far away. He's loosey-goosey. And obviously his eyes are almond shaped. His ears are forward. He's a black cat, so it's a little harder to see his whiskers. But this is a very relaxed cat. Limbs and tail away, loosey-goosey. And this is how I think of it, like super loosey-goosey. And as the cat becomes more conflicted, things kind of start to come in more and more and more and more. So that tail, my paws might be underneath me, that tail's close to me, and the trigger or scary thing keeps happening. I have to attack now, right? So I talked a little bit about forward, middle, backward. If they're shifting their weight forward, that's usually indicative of interest or relax, but it can be indicative of offensive aggression as well. Middle tends to be neutral and backward tends to be fear. So this is a boring infographic from a book, but I really love it because, again, I hear so many labels and memes about cats being grumpy, and I say there are no grumpy cats or painful cats, because I truly don't, just like, if I'm grumpy, there's a reason for that. Maybe I didn't sleep. Maybe I'm not getting adequate nutrition. Maybe I'm painful. But with cats, we're just like, they're grumpy and that's the way they are. And it really breaks my heart, because when I tell people, actually, we can help, it doesn't need to be that way. And cats aren't just grumpy, right? So I really like this because you can see more relaxed body language. And then again, that cat's kind of getting smaller and smaller and smaller. So whatever is scaring them, let's say, is continuing to happen. So, and as this textbook infographic says, last ditch, they have to become offensive aggressive, because the last thing cats want to do is fight. They are such sweet animals. But just like any learner, if someone was attacking me, I'm a very kind person. But if you came at me, I would probably do some behaviors like moving away, looking away, trying to reduce that conflict, and then maybe telling you to stop. And then if you keep coming, I punch you. But I'm not an aggressive person, right? Because we have to remember that aggression is not a diagnosis. Aggression is just a normal communication tool. So if a cat is exhibiting aggressive behavior, that's information for us. And I won't label that cat, because again, this cat bit, so they're aggressive based on what was happening. Because I'll be honest, my friends wouldn't label me as aggressive for punching that person after they tried to attack me for an hour. But that's what I see happen with animals a lot. So we just need to consider that. So again, Lucy Goosey, awesome cat. If a cat is resting on their back like this, that's a really good indicator that they feel safe. They feel so safe in that environment. They are exposing all their vital organs to be murdered, because cats are prey predator animals, which is why you may have heard we don't want to touch cats' bellies, because it's really rude. And yes, some cats, like my cats had kitten kindergarten, kitten socialization. My one cat enjoys his belly being rubbed. But let's be honest, on a bigger scale, the majority of cats do not like their bellies touched. It's very rude. And that's why, because you're touching a really sensitive area. And what ends up happening is they grab and bunny kick, which is not great for you or for the cat, or they just disengage. So that interaction started off on a negative note because they were resting comfortably, showing that they felt safe. You touched them inappropriately, and then it ended on a negative note with them disengaging. I always joke with caregivers and I say, if you had a really deep sleep after not sleeping, and I come in and I like hit you or touch your butt, that's weird. And you're going to get upset. I know some people that resort to physical aggression being woken up within a second. So just tell your friends, let's not touch kitties' bellies, mostly overall. And then as they become more conflicted, many cats go into flight. So trying to escape, which is why hiding is a natural coping mechanism. That's why I mentioned the importance of if a cat is in a cage at a hospital or in a shelter, it is a box and hiding place is as important as water and food. So because we know that cats hide as a natural coping mechanism. So you can see both of these cats tried to get away from things. They're kind of moving on their side, and that trigger keeps coming. So now that cat's starting to roll and have the paw out. So that's kind of what's happening here. And then again, this more subtle arousal versus this cat is very aroused and likely to exhibit aggressive behavior. But I truly have not seen a cat like this in quite a long time. But I have with some cats who have had some specific medical issues that I won't get into. So again, let's say you're noticing your cat, you're like, my cat exhibits behavior like this, or my cat appears grumpy a lot. That's helpful information, but that's where you want to take a quick video and share that with your veterinary staff or reach out to a behavior professional, because it's so helpful for us as veterinary professionals to have that information. And we need your help. We don't live with your cat, right? You're their caregiver, and it's a team effort to help us figure out exactly what's going on with them, which is great. And then there's that fidgeting. So we have fight, flight, freeze, and fidget. So freeze is those cats that are frozen in fear, which we commonly see at the vet hospital. Flight is what normally happens. The cat escapes. Like, let's say your cat is fearful of people that aren't familiar coming into your home. They escape under the bed, or you may have another hiding place that they go to. there's fight, and then there's fidget. So these are those in that chart I shared earlier. This is like level 1, 2. So these are the signals that commonly get missed, which is then we start to notice level 3 or 4. So these are essentially normal behaviors, but taken out of context. And we see these a lot with dogs too. So the cat is yawning or they're lip licking, but they didn't just have a treat. They freeze. So similar to that cat with the whiskers, it was only a photo, but she froze for a second, but then within 2 seconds returned to baseline. So similar to if something startles you, you freeze, but then you return to baseline. So that's what I mean by freeze in this context. They may blink a lot. They may groom or look away. This cat subtly, so this is a look away. Sometimes we don't recognize look away until they're like literally doing this or shifting their weight, but this is looking away. This is hey, I'm a little conflicted. I'm a little unsure about this, whatever it may be. That's where we can consider context. And then those eyes are starting to go from almond shape to round. There's some tension in between those 2 ears, and there's a subtle lip lick. So this cat is exhibiting a few indicators to tell us that they're kind of unsure, right? We also can notice you'll notice whisker twitching or out of context play behavior or scratching. An example that I commonly see is, let's say you have 2 cats, whether you're in a cat room or with your cats at home, and your one cat is here, and instead of your cat walking by like this, your cat does a circle, and then when they get here, they go. That's a displacement behavior. Like, I'm a little unsure. Like for humans, we drink water when we have those subtle displacement behaviors too. People at the party who are like, I need another drink. But if we can recognize these and change our approach or remove that trigger, it's really helpful because we can prevent our cats from getting even more escalated. So here's an example of a cat that subtly conflicted. So something kind of just spooked them. And you could see, because those eyes are fairly almond shaped still, and those ears are starting to just go to the side, and he shifted his weight a little bit and crouched, and his head is over his body. So instead of here, it's like higher up, and his tail started to twitch a little bit. So what happened is he heard something in the leaves, like in a bush, like a few feet away. And then he quickly returned to baseline and kept playing in these lovely green things. So again, super subtle conflict, and it's helpful to have context, but when you're there, thankfully you have that. So I know I've been mentioning defensive and offensive. So in most cases, what we are seeing is defensive aggression, which is this. So everything is back, like those ears are back, those whiskers are starting to splay, those pupils are very dilated, the cat is actively hissing, everything's close, but the trigger keeps coming, so now the cat's paw is up. Versus offensive, where everything is forward. So this is the cat in that infographic that between like 12, 16 boxes, it was 16. So you can see those pupils are constricted, still vocalizing, ears are down, there's piloerection, the claws are out, and the cat is actively climbing the wall in preparation to jump. So this was a feral kitten, and the photo was taken. And I do not put animals under stress for photos. And my friend walked away, and then she went back later with a drop trap, because even though animals are small, it's still not appropriate for us to just grab them. Because I do a lot of TNR. Let's let the drop trap be the bad guy, and let's be safer if we want to work to help these guys. But that's context. This kitten was just terrified. This is another example where any of you who work in animal welfare or vet med, we have metal bowls, and when they fall, they are so loud because so a metal bowl dropped, and a tech that I we work together a lot. She happened to get a photo at that second, and within 3 seconds, he returned to baseline. So this kitten was pretty terrified. So that head is lower than normal, and he's making his legs bigger because he's like, I'm big and scary, go away. Essentially is what he was doing. But he quickly returned to baseline within a few seconds. It was just a very intense startle response to that metal thing, which I understand because it's so loud. Again, flight, we talked about, we have that tense face and body. So usually we'll also note a higher respiratory rate. So you may see your cat's abdomen going up and down faster because they're breathing faster, similar to us when we get really fearful or overwhelmed. Everything is really low. Everything's close together. In this context, the cat is actually looking at the threat, which is a person, and that tail is just tucked really close to the body. Here's another example of freeze, because I do a lot of kitten socialization work. And unfortunately, we utilize a technique called flooding a lot, which thankfully we're getting away from, which is essentially if a learner is afraid of something, you kind of expose them to that full force. So, but I can understand how someone might misinterpret this cat as relaxed and pick them up, which is, this cat is not relaxed. This cat is frozen in fear. But it can be a little harder to note that with kittens too, right? Those ears are to the side. That kitten can't get any smaller. Like everything is as close as it possibly can be. That head is low. Those whiskers are not here. They're here, right? And this is, that body's kind of flattened. We may call it meatloaf cat, right? We see a lot of cats frozen in fear for veterinary procedures. But again, there are things we can do to help. We could use towel handling, use pre-visit pharmaceuticals, sedatives, all that lovely stuff. There's thankfully lots of things we could do to help. But if we're not addressing their body language and we don't know how to identify it, it's really hard for us to help manage and or prevent them from getting like this. And then to end, I'm really sensitive, my learning history, to painful cats because it's so common. And chronic pain can be really hard. Chronic pain is there's a very, very high prevalence in cats over the age of 7. We see it in cats of all ages. But chronic pain is really hard to diagnose, even at the best veterinarian ever. Just like in humans, if you have chronic pain, you most likely have to go to a lot of doctors and really advocate for yourself, even though all those doctors are amazing and started working in human medicine to help people. So I think it's really important to talk about painful body language just a little bit, because the first sign of an animal not feeling well or having a medical issue is a behavior change, which is why working in behavior and vet med has made me very skilled at this. So what we tend to see is that hunched appearance or curved top line. So you can kind of see this cat's back is kind of, everything is closed in. So that's something that we commonly see. Or this cat has a really, I mean, hers is essentially a triangle. That's a really hunched curved. And this is a super senior kitty I was seeing. She's awesome. We got her pain identified and managed. And this is her playing with a puzzle toy. Love it. They also tend to carry their tail low most of the time. We also look at their general mobility, ease, fluidity of movement. So as you can see, this cat is turning around, but that mobility is not fluid. Very slow. And that tail is held down. And they actually they kind of stumble a little bit as they're turning. All of that is information. And then I also note increased irritability or aggressive behavior. So when I say aggressive behavior, I'm thinking biting, growling, scratching, because again, I'm a little sensitive, but the amount of painful cats I see just labeled as grumpy and no one even thinks about pain. It's heartbreaking. And I've worked with so many amazing caregivers where we've worked together to identify their cat's pain, and they're like, he's not cuddled me like this since he was 7, and we all just cry together because the caregiver feels horrible, even though they're amazing because they reached out for help. They didn't know this. This is hard to know. I didn't know this as a vet tech. I got better and better at it. But it's just such a beautiful, he wasn't an aggressive cat. He was a painful cat. And then also there's an app called the Feline Grimace Scale that I highly recommend, whether you're a caregiver in vet med or in animal welfare, downloading. So unfortunately with dogs, we have so many breeds that we can't do the same type of pain scale. But with cats, we've realized through research and this Feline Grimace Scale app, which is one resource for it, that their ear position, the tension or orbital tightening around the eyes, and where their whiskers are, as well as head position, tells us a lot. So, for example, this first cat, they're a little conflicted about being in this cage and this camera, but from a Feline Grimace scale, their whiskers are sitting where they naturally are. They're doing that curve. Versus this is moderate, and this would be more severe. Again, just these quick labels for this context. So this cat, I mean, that orbital tightening, think of a human with a migraine. You can just see it. You don't even need to be a veterinary professional. You just look at these cats and you're like, I can't explain it, but something is off. So there's a lot of orbital tightening. And what happens with whiskers with pain, they straighten out. When it comes to whiskers, they naturally curl, similar to this and many of the other cats I've shown. When cats get painful, their whiskers straighten out. And this cat, he's so painful that he can't even keep his head up. So his head is down. So this is my cat at 3 a.m. In the middle of the night when I woke up. And she is very painful. There's a lot of tension around her face. She's breathing a little bit more in depth. There's a lot of orbital tightening. We went to the ER and everything was fine. My cat is weird. Of course, I have the medical mysteries. But she's great now because I know all of you are worried because you're amazing people. So these are just a few examples from some of my caregivers because, again, behavior is medicine and medicine is behavior. So as you can imagine, I tend to see a lot of medical issues, including pain, either be one of the main causes or a really large contributing factor to some of the severe behavior concerns I deal with. So we always work together with their vet team. I teach my caregivers how to identify pain. So this is an amazing cat named Luna, and she has a lot of medical issues that are very well managed now. But you can see that orbital tightening, oof, face tense, those whiskers, that's a straight whisker, and that head is low. This is the same cat a few years later. Her vet and her vet team and her caregivers are amazing. She has a lot of chronic medical issues that are very well managed, but she was having a flare-up, and my caregiver recognized it within a minute. And she sent me this, and she's like, I'm taking her to the vet. And I'm like, I love you so much that you have, you're so empowered that you recognize this and you can get your cat help sooner. And then also show this to your vet too. It's just great. Here are some other examples that this is more subtle, that orbital tightening around the eyes, face is tense. The coat appears as if someone petted the cat. So we do see matting, right? That severe matting with painful cats who aren't grooming themselves as much. But sometimes it just looks like someone just petted them, but they didn't. And this is that arch back, kind of folded in, tension around the face. And this was actually a caregiver of mine I'm working with whose veterinarian prescribed a very appropriate medication for this cat. And this cat's baseline was greeting me with soft, relaxed body language. This is my third time at this house. I walk in and I saw this. And I was like, I'm just taking a video for the vet. And I asked her, did anything happen? But body language from a medical diagnostic standpoint is so helpful. This cat's baseline was soft, loose, relaxed. And although it's very, very rare, this cat happened to be having a negative reaction to this medication. So thankfully, we shared that with the veterinarian. We got her on a different medication. But I can also see, because that caregiver may have just said, I'm not sure what's going on, and maybe have not reported it. Not that the caregiver isn't amazing, but once I point these things out, people can't unsee them, which is kind of great. So when it comes to whether you're at your friend's house, you're in vet med, you're working in animal welfare, I'm always sharing what I'm seeing. I'm not saying your cat is scared, right? We're communicating in a kind, effective way. I'm describing how I'm addressing fear, anxiety, and stress, and how it benefits the cat, which is more in animal welfare and vet med, because even if I'm going into a foster's home to do vaccines, I'm describing everything I'm doing because I can plant seeds for that foster or whoever else is there to better understand cats and interact with them in kinder ways. So it's great. And then some other more vet med related stuff I won't get too into. Oops, skipped it. These are really great body language scales I mentioned earlier, because I understand in vet med or animal welfare, or I have a lot of my caregivers actually keep journals of behavior, like data, because patterns it's really helpful to do, especially with some of the severe behavior issues like aggression and things like that. But I understand that we can't always write ears back, piloerection here, like a whole paragraph. So I really love body language scores. These can be really helpful, but they need to be taught. It's not as simple as saying, here, we're using these now, right? We want to have a lecture like this. We want to do FAS scoring together with someone that's more skilled in understanding body language, and then start to implement it. Because sometimes I just see it be given and I'm like, you're setting up people to succeed. But these are two of my favorites. This is one from Fear Free, and Fear Free Happy Homes has a lot of awesome free resources. So I highly recommend it. And then this is another one that I really like. It's a little more in depth, but they're both great. There's even more. These are just my two favorite. And there's a lot of reasons why I love using these, but a few, it's an objective measure, right? We're not saying this cat is fill in the bad word blank, right? We're going to tell people how the animal is feeling based on observable signals. I've had cats for 20 years. This cat feels like this. Based on what? Not that that's not important, but I've had teeth for 39 years and I don't want to pull your teeth out. I am not a dentist. Do not let me do that. So that's helpful. It also helps us to ditch labels. So there are a purpose for labels, and they can be helpful, but also they can be really detrimental and harmful. So by using a body language scoring system, we just set up human learners to not use as many and describe behavior. And then also they tend to have more empathy for the animal. It empowers people to respond appropriately based on the info they receive in real time. Especially as someone that handles fearful cats, I can change what I'm doing in the second to make that animal less stressed. And that's because I understand body language. If you're clicker training your cat, or you're doing a play session with your cat at home, and you can literally adapt whatever you're doing based on that individual cat, because we're all individuals in real time, because you're understanding their body language. It's transferable. So again, vet med, caregivers, everyone can use it. And then I've already touched on diagnostically, body language tells us a lot. So I think it's a really helpful diagnostic tool from a vet med, animal medicine perspective. So in summary, behavior is on a spectrum, which is why it's so fun. It's not absolute. When looking at body language, we want to look at the entire picture, including the whole body context. You may or may not, if it's your cat, you know what your cat's baseline is. Even in animal welfare, I always tell people, you're so lucky because in many contexts, you know what this cat's baseline is. So we can identify when that cat's baseline is off, which can be indicative of a medical issue, or maybe there's a new stressor in the environment. We should put them in a separate area. Again, once we can identify it, we can help. We want to avoid labels and describe what you see. And one of my favorite trainers, Chirag Patel, said this so long ago, but it still really cuts close to me. We want to listen to their whispers so they don't have to scream. So we want to listen to those conflict behaviors so they don't have to bite or scratch or become piloerected throughout their whole body. I really thank Every Dog for having me. I love everything they do. Thank you to all you amazing people. I even saw some of you in the chat who are like, I'm not a cat person, I'm still here. Click, treat, verbal praise. Thank you for being here. If you want to learn more, I have more resources than you'd ever need at my website for free, but I also have I have a pain body language, a cat body language, and then I share a lot of things on social media regarding just cat and dog behavior, body language, and vet med related things. But thank you.
Awesome. Thank you, Tabitha. Anybody who is in the chat and has questions, now is the time to put them in there. I know Tabitha covered a ton of topics
Yeah.
in there. So if you have any questions, now is your time. My quick reminders while you're typing things into the chat. Again, we are a 501c3 nonprofit. Thank you to everyone who donated. And if you would like to donate, you can do that at everydogaustin.org. We have a ton of cool upcoming webinars coming up. I think our next one is from Debbie Martin, and it's about sound sensitivity and how to help animals with sound sensitivity. We've got one coming up about dogs who maybe have high energy needs but are injured or have a reason they can't do a lot of exercise. So lots of fun stuff coming up. So definitely check those out. And if you need anything in the Austin area, we are here. I don't see anything in the chat, so I'm going to give us another 10 seconds. And or if you have a favorite cat pun or cat joke, I will also take that in the chat. Just saying. Sometimes we have technological difficulties and I lose a speaker and I make people in the chat tell me jokes. So
Cat
this
puns
isn't,
and dad jokes are my favorite thing.
it's so great. It's so delightful.
Think where
Any last thoughts? Listening to the whispers. Someone says they like that thought. Where do you start with a mystery?
as in behavior mystery or mystery book? Context.
I don't know. I'm like, is this going to be a joke or an actual question?
It might be a joke. Amanda, is it a joke? I think it might be a joke. Where do you start with a mystery? Oh,
Not a joke. Okay. A behavior mystery. Okay.
oh no.
We both got really excited.
They're gonna write more in there.
During the last one I had, we had a great veterinary behaviorist on talking about different medications, but she lost internet entirely for about 10 minutes. And we learned jokes like, what do you call a dog who does magic? And it's a labracadabra. There you go.
Oh, Daniel asked about a hypothyroidism treatment. I would need a lot more information, Daniel, but that is the treatment you mentioned is great. It's a wonderful treatment. And I wish you and your cat all the success. Oh, redirected aggression. How do you hunt down the real trigger? Yeah, Daniel, it's a really great treatment. So there's a lot of information. One of the first things I would recommend for hunting down a trigger is keeping a journal. So getting the what, when, why, where, right? When does it happen? What's happening? Having people record outside, because so many times people say, I don't have animals in my backyard. And then we record overnight and woo, I am not even going to get into some of the things I've found. So I always tell caregivers, I'm like, just humor me, take a video. And then, yeah. So I think keeping a journal to start is really, really helpful. And then also thinking about the who, what, where, when, and why to start, and getting the context of you may even start with that journal, you may start to notice patterns, which is really helpful. Oh, my cat gets, for example, maybe a pain injection or along with some other meds. And hey, we've noticed it's the last 2 days before her next injection that we have these redirected aggression. So you'd be surprised. You could really identify patterns, but I can get a lot more into that, but that's a whole nother lecture. And I do have some aggression stuff on my social medias that I highly recommend. But I think starting with a journal and focusing on the 5 W's are a great way to start.
We had another question about cats in the shelter. So a shelter cat that is biting seemingly without notice, but while doing like bed kneading and seeking petting.
So I know I always joke in behavior. I'm like, I need more context. And this is why we ask for behavior consults. We need a lot of information. So based on just what you've said, if in the context you provided, if a cat is actively kneading and biting, I'm guessing they're biting a person, I would think it could be a lot of things. It could be an underlying medical issue that I'm not going to name specific disease processes without getting more information. Because sometimes we can see that, like pain and other medical issues, biting bed and or person. Oh, so they bite their bed too. I'm going to be honest, based on the fact that they might bite a bed or a person, the likelihood that there's an underlying medical issue is very high. I see that a lot with cats who have hyperesthesia or chronic pain due to osteoarthritis, GI. I mean, just like humans, we can have oral pain, GI pain, osteoarthritis pain, because they essentially, some cats become so sensitive to touch that they can even generalize it to people near them or beds because it hurts. So yeah, we can't get too much into this because you mentioned a specific drug. Gabapentin is helpful for neuropathic pain, but it's not an anti-inflammatory. There's different pain pathways. And I wish there was just one drug that just makes everything better, but that's just not how it works. So what I would recommend to you, lovely person, for relaxing. Okay. Gabapentin's more of a drug for as needed anxiety. If you're recognizing more signals of chronic anxiety, something like an SSRI or a TCA, but again, that's something I need a lot more information to discuss that. But if he's exhibiting signs of more of a generalized anxiety, gabapentin is not a drug that works in that way. Yeah. So what I would recommend doing is getting a video of it. As management, no touching him when he is needing. Ideally, no one would touch him unless he gave consent, which is I talked a little bit about that, but I have more resources. So I think great thing to start with is no one touches him unless he gives consent. And you may notice he never wants to be touched, which is okay, but that's also really helpful data. And if he is, because sometimes people are like, he leans in, but then that means you pet once for 2 to 3 seconds on the head, shoulders, and neck. So a lot of people are like, Tabitha, my hand was here, he leaned in. And then they're like, and I'm like, whoa. So consent is, and then if they lean in again, cool. Again, you're a stranger. And he also may be getting overstimulated from the petting. So I would need a lot more information, like videos and things like that. But I do, especially the fact that he's biting his own bed. I would need a lot more information, but that makes me think that there's an underlying medical issue it's very likely. And I would, just from a management perspective, especially because he is biting, even if it's being interpreted as he is asking for petting, if he's biting with most of these interactions, I wouldn't say he's enjoying the petting. So that's where I think as management, while you work towards figuring out what's going on, hey, everybody, let's just not pet him. You can give him enrichment in other ways. He'll be okay. Yeah, I can understand that. But we definitely reach out via Chirrups and Chatter. We could talk more because I think I deal with a lot of shelters and they're like, but it seems like and then I see a video and I'm like, let's unpack this together. It's going to be so much fun. Context. And thank you for what you do, you awesome person in the shelter, recognizing that it's a weird behavior and that we should look more into it.
Awesome. And if folks have questions about behavioral medications and medications we use about anxieties, we had a great presentation a couple of weeks ago from Dr. Esther Eng out of the Animal Behavior Wellness Center, all about the different kinds of meds that exist, as well as if you're like, but what about CBD? It's in there also. A lot of it is dog focused, but a lot of the information is great for kitty folks as well. So lots of great information there. Some wonderful upcoming webinars on a variety of things. Definitely stay tuned. Check out Tabitha's information on Chirrups and Chatter if you haven't already. And thank you all so much for coming out tonight to learn about kitties and how to make their welfare great and coexist with them. All right. Have a great night, everyone. Bye.